I think some of the benefits of the St. Joseph's Residency program and why people would be compelled to come here are its wonderful education, its commitment to the community gives them a well-rounded experience and really prepares them for the future in their practice.
We have a strong, broad-based curriculum to train you in all the aspects of family medicine. But we really want to take that extra effort knowing that each individual truly is an individual, and what one resident might be seeking in family medicine might be very different from what another is.
You're afforded a lot of autonomy, so you can mold your practice as whatever way that you want to. You can also get a very well-rounded experience. Now we have very diverse interests in our faculty and in the experiences that you can obtain. And most importantly is that the other people that work here are very supportive of our program and really want you to do well, and will be there to help you along the way.
We constantly look for better ways to improve both our clinical setting as well as our educational setting for the residents. We look for ways to embrace new technology.
Our residency program was the first residency program affiliated with medical college that went to an electronic medical record, and we've had it now for about 5 or 7 years. And every year we actually give presentations to other people considering the electronic health record, showing the things that we do.
You can check notes from patients at home. You can finish clinic notes at home or in the office. We are tracking immunizations that way, tracking blood levels. Hemoglobin A1C is all in the computer, and it's very, very nice and well organized.
Our patient base is very broad, so just fulfilling your clinical requirements will get you a very broad exposure to the most common conditions that family medicine physicians deal with on a day-to-day basis.
We see basically everything on a daily basis.
You will have had enough experience in geriatrics, pediatrics, diabetes, asthma, etc., that you really have a broad range of clinical experiences.
That's another joy of teaching, is that, not only are we molding this next generation of doctors, but we're also keeping ourselves current, and we're on this journey together as we go through their residency.
We have students, we have nursing students, we have PAs, we have nurse practitioners that come through here and the residents, so there's lots of opportunities to teach other people. It helps them learn, it also helps us learn what we know and what we don't know, so we can become better doctors as well.
I think the faculty are important they have a responsibility for the molding and the running of the residency.
Faculty was certainly near the top of my list.
I definitely think that's one of the strengths of the program.
I really liked the faculty and the residents that I met during my interview process.
The clinical staff are all going to take a very active role in your educational component, but we also care about overall you as a person and developing into a young professional.
You spend a lot of your time interacting with the faculty, and that's a big part of where you get your knowledge from. So having faculty that you can form relationships with, be friendly with, get to know a little bit on a personal level, and that are excited about what they're doing is very important.
I'd like to be a part of the molding of the next generation of doctors.
Milwaukee is wonderfully situated by a lake.
It's a really nice sized city.
It's the balance between the big city and the small city. So you get the big city attractions. We have a festival downtown every summer. There's festivals every weekend. The art museum.
You're exposed to almost everything that you are in Chicago. We have great restaurants, great cultural events. And we have the ballet, the symphony, except you don't have a lot of the negatives of Chicago, of the traffic, the parking, the high expense of living.
Community.
Balance.
Support. Experience.